Hello guys, how are you? So guys, we are going to continue our lecture on the treatment of hypertension. So guys, if you haven't subscribed to our channel, then still please subscribe our channel and click the bell icon. So guys, we were talking about that the cardiac output can be decreased by the diuretics, but just a little decrease because only excretion will occur, but still renin is secreted and it will try to, because we will only be giving one diuretics at the thiazide loop. We cannot give all of them because he will have more side effects, because we want some of the things to be absorbed as well. So the renin will reabsorb these sodium or water from some other part of the tubule. The tubule is like this, ascending and descending loop of Henle. Someone absorbs sodium, someone absorbs water. If you want me to give a lecture on this also, I can give. You can just comment in the comment section. So guys, what we will do for decreasing the diastolic pressure, we must block renin or angiotensin converter enzyme or angiotensin 2 or this angiotensin receptor. So we have the drugs here: Aceinhibitor, angiotensin receptor blocker, or renin blocker. But for the renin blocker there is just one drug and it also have many side effects, so usually the renin blocker is not used. Okay, only angiotensin receptor blocker. You might have seen losartan, olmesartan, valsartan. This has been used, but the first line treatment is the Aceinhibitor because of its less side effects, and we have many defined categories. So it is a good drug. Benazepril, captopril, enalapril, fosinopril, lisinopril, all these things. So this one is the best to be used, and it is the first line treatment. So let me tell you first line treatment as well. Which is the first line diuretic? It is the loop diuretics. Loop diuretics, anyone. Mostly used is furosemide. Okay, and Aceinhibitor. You have to do two drugs, right? Because we also have to decrease the diastolic pressure. So loop diuretics and Aceinhibitors are mostly used, or you can say furosemide plus captopril. These are the first line treatment of hypertension. So in this way you can do this. You can decrease both diastolic. Aceinhibitor do what? It will block ACE enzyme and angiotensin will not be produced. No one will constrict the arterioles and no one will cause secretion. So definitely systolic blood pressure is decreasing and diastolic is also decreasing because systolic is not working. We are giving diuretics and but we cannot block all the time the alpha receptor as well, because there are many alpha receptor in the body. I just told you beta and alpha. You cannot block the heart here on the beta receptor all the time, because as most of the drug is also beta 2 blocker. Most drug are the beta blockers, as we told here. These are the beta blocker. They just don't only block B1, it also block B2. Most of them, only some of them like metoprolol, these only block beta 1, but mostly it is dangerous. So we only use beta blocker when someone has severe heart disease as well. If someone has severe heart disease as well, then we use beta 1 blocker. So it will block here also, and it is also present on kidney, and it will block both of these. And because beta 2 is why beta 2 can't be blocked? Because it is also present in bronchioles, and if someone has asthma, then he has a problem. And it is also present, beta 1 is also present on the bladder as well. Beta 2 is also present on GIT, you can say, and it decrease motility. And then if we give it, its person will also have diarrhea. So it is not good to give beta blocker. But if someone has severe heart disease, only in heart disease you can give. In severe heart diseases like ischemic heart disease, supraventricular failure, tachycardia, anything like this. Okay, so we don't usually use beta blocker or alpha blocker as well, because alpha receptors are also present on many sites of the body. If we give alpha blocker like here, the alpha blocker, it will block the alpha receptor, but maybe it is also present in GIT somewhere, then it will also block it. If you want a complete lecture on these are sympathetic receptors, alpha 1 adrenoreceptor. If you want a lecture on sympathetic receptor, then you can comment in the comment section. So this was all about it, alpha receptor, beta receptor, but most importantly we use loop diuretics and Aceinhibitors. Okay, these are the most important things. But some, the Aceinhibitor has side effects of cough and flu. Some might also decrease the volumes, and some causes ototoxicity, hearing loss. So these drugs are sometimes dangerous, and more dangerous in the pregnancy. Remember, more dangerous in pregnancy. So all the hypertensive drugs are contraindicated in pregnancy, except only two drugs. Which are those two drugs? Methyl dopa and hydralazine. Only these two drugs can be used in pregnancy, and there is no any other drug which should be used in the pregnancy, remember. And for other person you can use Aceinhibitors, loop diuretics, beta blocker, anything, but the first line is Aceinhibitor and loop diuretics. Okay guys, and there is another category, hypertensive emergencies. If someone comes to you and he has blood pressure above 200 by 120, and he is having target organ damage, or maybe sometimes someone don't have organ damage, and he is in very serious condition, then what you guys will do? You will have to give hypertensive emergency drugs like nitroprusside, nitroglycerin. These nicardipine, it is a calcium channel blocker. I didn't told you about the calcium channel. I think the calcium channel are also present on heart, and on every cell it is present, and calcium will come in and it will cause more contractility, more constriction. Okay, but we don't give calcium channel blockers mostly, because what it will do, it will decrease contractility of all the parts of the body. So it is very dangerous if someone have a little bit high dose, and using it every time will make the person paralyzed. So it is not good to use calcium channel blocker. But in severe cases, in hypertensive emergencies, these two are calcium channel blockers, and we are using it. Nitroglycerin is a nitric oxide as well, and these drugs are available in intravenous form, in IV form. So we use nitroglycerin as well, and these are these are adrenergic receptor blocker. This is the most dangerous blocking thing. If you want to block, it will block every sympathetic stimulation, every sympathetic stimuli will be blocked, and these drug will block every parasympathetic stimuli, but at least at that time the person's blood pressure will get down and he will be normal, and he will don't have any target organ damage. So it is best sometime to use this, and maybe someone also use calcium channel blocker as well, but mostly labetalol is used a lot, and nitroglycerin is also used, clavitipine also. Any of these can be used in severe hypertensive emergency intravenously, because if someone will come to you and he really wants his blood pressure to go down for just 1 day or 2 day or 3 days, if you can do, it is not the type of drugs, because hypertensive drugs should be used for lifetime. If someone has hypertension, he must use those drugs for his whole life. So it is better to give less side effect drugs like Aceinhibitor and loop diuretics. So if someone has emergency, then you can use this, but only for 2 days or even 1 week. Okay, but not every day. So if someone come to you with 200 by 120 blood pressure, then you can just give him nitroglycerin or labetalol injection or clavitipine injection, anything, it will work. Okay, so guys, this was all about the hypertensive drugs, and in the next lecture I'm just going to give you guys some examples so you guys can understand it more clearly. Okay guys, bye bye, see you.